Hello and welcome to our annual training today. My name is Mike Wolf from the County Employer Group with the North Dakota Association of Counties. And first of all, I'd like to thank you all for taking time out of your busy schedules to attend our training. This is our annual training that we are required to do through our insurance company, Workforce Safety and Insurance. And so we're going to talk a little bit about claims management, some personal protective equipment, and our drug-free workplace. Some of the claims management stuff is some refresher stuff, things we've been training on in the past, but it's always good to have a refresher course on this. And so we'll get started with our training today on our claims management portion. And first of all, we're going to talk about incidents in the workplace. And so what is an incident? An incident is basically any time an employee has some type of an injury or an accident, or maybe there's some type of exposure to a bloodborne pathogen or chemicals. And the key with incidents is maybe there has been an injury or an exposure, but it's not bad enough that you need to go seek medical treatment. In these cases with incidents, it's very important that we report those, and we'll talk about that. So when are you covered at work under workforce safety and insurance, workers' comp insurance? It's basically anytime you're in the course of your employment doing something required by your employer. You're not covered if you leave the work premises on breaks for personal type issues. So, and another reminder too, with social service employees, continue to follow the same reporting procedures in the county where you are based out of. And make sure that you follow all the reporting procedures your county is set up for filing incidents with workforce safety and insurance. And if you don't know what your county's procedures are, make sure you contact your supervisor, risk manager to find out about that. And it's very critical that we're reporting these incidents, because what we're doing is documenting that something has happened to you in the workplace. And it's very critical that we document that, because number one, we need to report that to workforce safety and insurance on your behalf. And then we might need to make some accommodations for you depending upon the nature of that incident. Maybe you were walking down the hallway and you slipped and you caught yourself. You didn't actually fall and you twisted your back or your knee. We need to know about that so that we can file that and record that with workforce safety and insurance. Then, depending upon how your back feels, because you didn't go see a doctor, we might make some accommodations for you until you do feel better. So why should you notify your employer when an incident occurs? We need to document that with workforce safety and insurance so that if 2 or 3 or 4 days from now, maybe a week from now, that injury that you occurred when you slipped in the hallway to your back doesn't get any better, and all of a sudden you think it's come to the point that you do need to go see a doctor. If you haven't documented that with workforce safety and insurance, all it's going to do is raise some questions, not only from your employer as to whether that happened at work, but it's also going to raise questions from workforce safety and insurance, because after all, workforce safety and insurance is an insurance company. And what's one of the first thing insurance companies do when a claim comes into their office? They're going to look for a way to deny that, and we don't want to give them any basis for that. And a lot of times we have county employees who don't work in a group setting. There's not always witnesses to incidents that might occur in the workplace. And if you're by yourself and you don't have a witness to that incident that occurred, and you don't file that with workforce safety and insurance, that's a basis for workers' comp to deny your claim, because you may not be able to prove that that actually happened at work, something that might have happened to you 2 or 3 days ago. So exactly what type of situations do we talk about with incidents? Cuts and lacerations, strains and sprains, to your knee, your back, your shoulder, repetitive motion discomfort, are ergonomic related issues where people are working at their workstations for long periods of times. If you develop any discomforts as a result of that and you think it's related to your work, or if you have some underlying conditions from maybe a car accident or some other type of surgeries that you've had that contribute to you not being comfortable in your workstation, we can do assessments to make sure that your workstation is set up properly for you to avoid any additional pain or discomfort for you. Plus, we have a lot of exposures to bloodborne pathogens, and probably that's the least amount of reporting that we have for incidents and exposures to bloodborne pathogens with workforce safety and insurance. And it's very critical because we have several different groups of people that may be exposed to bloodborne pathogens throughout the course of their day. And we really need to document those so that if at some point in time you may be diagnosed with a bloodborne pathogen disease, we have documentation and verification that that may have been as a result of your work. And so what workforce safety and insurance does, they'll look at your work history and they'll say, well, this person's worked for the county for 10 years and we don't have any incidents filed as far as exposures to bloodborne pathogens. So how could this possibly be a work-related injury? Versus looking at your work history and workforce safety and insurance, seeing that, yes, this person's filed several exposures throughout the course of their career with the county. There's a high likelihood that this bloodborne pathogen disease was a result of their work. And so don't think that anything's ever too minor to report. Even that cut finger or laceration, we've had several people who've had cut their finger at work, thought it would be okay, didn't report it as an incident. 4 days later, they develop an infection because they didn't take care of it. And as a result of that, workforce safety and insurance has denied their claim because they couldn't prove that it happened at work because there weren't any incidents. They didn't report it, and workforce safety and insurance indicated that that could have happened anywhere. So don't think anything is too minor to report. It only takes 1 to 2 minutes at the very most to file and document incidents with workforce safety and insurance. And we'd rather have hundreds of incidents on file to document and be on file for you than not to have any, and then try to defend you, trying to determine whether that incident actually did happen at work. And so that delayed reporting causes doubt from workforce safety and your employer, and we can eliminate that by making sure we file incidents within 24 hours of them happening. And then we're going to also look at that and maybe look at taking some corrective action. Why did that incident happen to you? And is there anything we can do to make sure we correct that, to make sure it doesn't happen to you again or someone else in the county, or maybe even a county resident? So don't think that you're bothering anybody by filing incident reports. We want to have those on file and documented for you. So now we'll talk about when an injury does occur and you do need to go see a doctor. So maybe it's from that incident 2 or 3 days ago and your back didn't get any better and you say, yeah, I need to go to the doctor now. Or maybe it's something that happens today and it's serious enough that you need to go see a doctor. Again, you follow the reporting procedures your county is set up for filing claims with workforce safety and insurance. And again, if you don't know what your county's procedures are, contact your supervisor or risk manager to find out about that. And you need to make sure that your supervisor and risk manager know that you're going to seek medical treatment, no matter who is responsible for filing that form, unless it's an emergency situation. But if you twisted your back or twisted your ankle and you decided you need to go to the doctor, you should call your supervisor and risk manager and let them know prior to you or while you're on the way to the doctor. And we need to report your injury immediately to workforce safety and insurance. We have a 24-hour reporting requirement as required by workforce safety and insurance, but we want to get that on file as soon as possible. And that's why it's important that you let your supervisor or risk manager know so that the proper filing can be done for you. And as soon as they know about it, I guarantee you your claim will be filed with workforce safety and insurance within 5 to 10 minutes of them finding out about that. And the benefit for you of doing that is now that claim number is on file so that when your medical notes come in and the doctor bills come in, they have a file to go to and they're going to get paid that much quicker, and your claim is going to be processed that much quicker as well. If we don't report that injury to workforce safety and insurance within 24 hours, your county is subject to a $350 penalty from workforce safety and insurance for not reporting your injury within 24 hours. Also, in conjunction with that 24-hour reporting requirement, there's also an accident investigation that needs to be completed within 4 days of your injury. And so the combination of that 24-hour reporting and the accident investigation being completed within 4 days go together. So if they both aren't done within each's time frame, that's the basis for workforce safety and insurance to assess that $350 fine to the county. Now, each county is different in who's responsible for filing that accident investigation. In most counties, in all situations, the supervisor in the department where the injury occurred is responsible for filing that accident investigation report. And we have a pre-filled form that you can fill out. So it's asking questions about that injury, and basically you're just asking questions that we're asking to find out what happened with that. In some cases, the risk managers do the accident investigation forms, or they may assist. And depending upon the nature and severity of it, maybe workforce safety and insurance gets involved, the CEG gets involved with helping conduct that accident investigation as well. And there's good news about the accident investigation. We're working on an online submission form that is going to be ready. We're hoping by the end of the year. And so it will make that process that much easier, where someone can come to our website, fill out the accident investigation report, and submit it immediately through our computer-based system that we've set up for that. So good news for making that process much easier for the people that are required to submit an accident investigation report. And also another important reminder to keep in mind is that if you work shift work, or maybe you're called in on the weekend to come in and do some work, maybe the road department has to come in and plow some snow. If you're injured anytime after 5 o'clock on Friday and before 8 o'clock on Monday, we have until Monday to file that incident or that injury to workforce safety and insurance. And if Monday's a holiday for the state, then we have until Tuesday to file that claim or that incident. However, if you're injured Saturday afternoon doing something, you should definitely still contact your risk manager and your supervisor. And depending upon the nature and severity of that injury, number one, we'll look at making some accommodations for you too. And number two, we'll look to see whether we need to file that claim form for you right away, or we can wait till Monday to file all the paperwork for you. So if you're injured over the course of the weekend, it's very critical that you contact your supervisor and your risk manager as well. We'll talk about the designated medical provider program. The designated medical provider program is a program through workforce safety and insurance where your county identifies designated medical providers that you must go see for your initial workplace accident treatment. Now, if you don't go see your designated medical provider for your initial treatment, it's a basis for workers' comp not to pay your claim. So this is a critical part of our training, that you understand who your county has selected as designated medical providers for you. Now, if you receive emergency care or you're referred somewhere else later on, that doesn't fall under the designated medical provider form. If you need emergency care and need to be taken somewhere by ambulance, we want to make sure you're getting the best possible medical attention as soon as possible, so emergency care doesn't fall under that. Now, even though your county has selected some specific designated medical providers, when you look at that list, you might say, well, I don't go to that clinic, or I don't go to that hospital, or maybe they haven't listed a chiropractor. You can also choose any additional designated medical providers you want to add to that form. So who are designated medical providers? Of course, doctors, clinics, hospitals, chiropractors. Some counties list ophthalmologists, your eye doctors, dentists, and a combination of any of these. Okay. The eye doctors and the dentists, I don't think it's really critical that we list those, because we've not seen any situations where an employee has been injured and needs to go see an eye doctor right away, or needs to go see a dentist because maybe they chipped a tooth. Because if you go to a medical doctor and you chipped your tooth, what's that medical doctor going to say? Well, you need to go see a dentist. There's nothing I can do to help you. So we've not had any claims denied because somebody didn't list an eye doctor or a dentist, because that's been considered as emergency care. So always keep in mind that when you look to see what designated medical providers your county has selected, if you want to make additional selections and add additional providers to that form, you have to do it prior to a workplace injury taking place. Okay, that's critical for you to know. Here's the designated medical provider selection form. On the top of this form is the portion where your county will list the providers they've selected as designated medical providers. In the lower two-thirds of this form is the section where you can add your own additional designated medical providers. Now, in a lot of counties, they don't select chiropractors because in some counties there's just too many chiropractors to choose from, so they leave that up to the employee. So if your county has not selected a chiropractor, or maybe your county has selected a chiropractor but it's not the chiropractor you go see, you have the ability to add your chiropractor to this form. Because if you're ever injured at work and you don't add your chiropractor and you think chiropractic care has worked for you in the past and you don't add that chiropractor and you're injured, you go to the doctor, what do you think the chances are of your medical doctor referring you back to a chiropractor? Probably slim to none, right? So this way, if you list your chiropractor on the form, you now have the opportunity to go see your chiropractor for your initial workplace accident. And then if that chiropractor at some point needs to refer you on to a medical doctor, then that's how that process works. So you can go see your chiropractor, but you have to make sure you list that chiropractor on the form. Now, you fill this form out once per year. It depends upon the time of year when your risk manager has you fill this out. A lot of counties do it this time of year. And even though you sign off on this form at a specific time during the year in your county, it doesn't mean that you can't come back and add a designated medical provider at some point in time in the future. So if you've never gone to see a chiropractor in the past and all of a sudden maybe you got hurt away from work and you went to a chiropractor for the first time and you said, you know, that chiropractor did a really good job. If I ever get hurt at work, I'd like to go be able to go see that chiropractor. So even though you signed off on this form on a specific date, you can always come back to your risk manager, whether it's a month, 3 months, 6 months, 9 months, up until the next time you fill this form again, and you can add a designated medical provider to this form at any time throughout the course of the year. You're not locked in once you sign off on it. Again, just remember it has to be prior to an injury taking place. And again, we have some good news for the designated medical provider selection form that employees fill out. We're working on an online process for employees to be able to go right online and fill this form out whenever the county requires you to do so, and you'll be able to add designated medical providers at that time as well. We're looking for that to be ready sometime shortly after the first of the year in 2021. So now we're at the doctor's office, and there's a doctor's report of injury, a C3 form. It's called a capability assessment report. And what this form is, it's very critical, and we need it every single time you go to the doctor, because this form determines your medical capabilities and your restrictions. And what that does is allows us to develop a plan for suitable return to work, and we can monitor your medical process. And it justifies the needs for us to make job accommodations for you in the workplace, or maybe it justifies your absence from the workplace. And technically, if we don't get this form every time you go to the doctor, we can't allow you to come back to work, because if we don't know what restrictions the doctor's placed on you, we certainly don't want to bring you back to the workplace and put you in a position where you may hurt yourself further. So that's why it's so critical we know what those restrictions are so we can make the necessary accommodations. And when the doctors place restrictions on you, you must follow those restrictions both on and off the job 24 hours a day, 7 days a week, until that doctor has lifted those restrictions. A lot of people think, well, I was injured at work, so I only have to follow those restrictions when I'm at work. But I can do anything I want to when I'm away from work, and that's not the case. So if the doctor's placed a 25-pound lifting restriction on you for the next 2 weeks, and you go home and you lift something more than 25 pounds, you re-injure yourself, you aggravate that injury, that's a basis for workers' comp to deny further payment of your claim. And so it's very critical you know and understand what those restrictions are. If you don't understand all the restrictions, make sure you contact us so our internal claims manager, Jennifer Mormon, can work with you to make sure everybody's on the same page with that. So we say no C3, no return to work, right? We tell you don't leave the doctor's office without it. Well, that's easier said than done, because a lot of times doctors will say, I'll send it in, I'll file it online, I'll fax it over, and they may do that, but it might take 2 or 3 days for them to do that. And now, since we can't let you come back to work, you're going to have to take 2 or 3 days of vacation or sick leave. And personally, we think you can utilize your vacation and sick leave much better than waiting for a doctor to send in their report. So if you don't get this report, make sure you come back, let your supervisor, let your risk manager know. If your supervisor and risk manager know you're going to the doctor, I guarantee you they'll be asking for it. And between your risk manager and Jennifer Mormon, our internal claims manager here, if you don't get it the same day that you go there, I guarantee you they will contact that medical facility, and probably 98 to 99% of the time, they will have that form back the very same day. So we will work to make sure that we get that, and make sure that you understand that we must obtain a C3 form after each subsequent visit that you go for follow-up treatment, because the doctor may be changing or eliminating any restrictions that they've placed on you. Now we'll talk just a little bit about our transitional return to work program. The county employer group has probably the most comprehensive transitional return to work program in the state of North Dakota. It's been a very successful program for us when people can't come back to their regular duties when they're injured at work. So what is transitional work? It's a process where an employee who might have been injured is brought back to work as quickly and safely as possible in predefined temporary job assignments. Okay, we've done our homework in this process. We went out at the beginning of developing this program several years ago and met with several county officials, supervisors, department heads, and developed a big, thick transitional work manual with hundreds of potential transitional jobs that people could do if they were injured at work and couldn't come back to their regular job duties. And so we work very closely with the doctor. It lends a lot of credibility with our doctors because they look at the very detailed job descriptions we have for our transitional work, and they can see we've done our homework because these job descriptions talk about standing, sitting, bending, stooping, lifting, temperature extremes you may be exposed to. And so the doctor knows we have a viable return to work plan option for you. We're not just saying it. A lot of employers tell doctors, yeah, we have a return to work program. And you know what their return to work program is? Hey, get back to work. We need you. And they're not concerned about the safety and well-being of their employees. And so a lot of times people will also say, well, why are you rushing me back to work? I got injured at work. Shouldn't I stay at home and rest and get better that way? Well, doctors will be the first people to tell you that work is therapy. Doing something is better than sitting around at home doing nothing for 2 weeks. Okay, so when we have an injury that occurs that's severe enough that you can't return to your regular job duties, that's when the transitional work program kicks in. Now, if you're in the auditor's office and you hurt your back, probably 100% of the time you're going to be able to come back to your regular job duties. We're just going to have to make accommodations for you for standing, sitting, breaks, those type of things. But if you're in the road department and you get hurt and you can't drive your road grader for the next 2 weeks, now we're going to look, is there something based on the restrictions the doctor's placed you under, is there something you can do in the shop the next 2 weeks until the restrictions are lifted? Well, if there's nothing in the shop because of the severity of that injury, then we're going to look in other departments within the county and determine a transitional return to work plan based on the restrictions the doctor's placed on you. And as I said, we work with the doctor, we work with your supervisor, department head, to determine a viable return to work plan. And nobody determines when and how you will go back to work and what you will do except for the doctor. As soon as the doctor signs off on the transitional work plan, then we can make sure that we've got you in a situation that's keeping you safe, allowing you to heal. Now, generally, a transitional return to work plan might be a couple weeks, 3 weeks. It could be longer, of course, depending upon the nature and severity of that injury. Now, what is the big success for our program? Our big success comes from focusing on people's capabilities rather than their disabilities. So often, so many people focus on what people cannot do rather than what they can do. And when you can focus on what people can do, that's when this transitional program becomes successful, because we're making sure we're developing a viable plan to return you back to your regular duties as quickly and as safely as possible. Now, what's the benefit for you, you might ask? As I said, you might indicate, I got hurt at work. Why are you rushing me back to work? Well, besides all the other things we just discussed, the number one reason we don't want you to go on workers' comp disability benefits because of a work-related injury is because they only pay 66 and 2/3% of your wage. Now, all of a sudden, because you're injured at work, maybe at no fault of your own, you're taking a 1/3 pay cut, and that causes financial hardships for people. To top that off, workers' comp has a benefit cap, so they're only going to pay a certain number of dollars for a disability benefit, a maximum dollar amount. And most of our county employees earn enough money in salary that they're affected by the benefit cap set by workforce safety and insurance. So we were seeing people losing 50% or more of their salary as a result of being injured at work, and that definitely causes financial hardship. So through our transitional return to work program, employees come back maybe in a transitional job, and you continue to earn 100% of your salary. Plus, all your benefits stay in place. Your health insurance, your retirement benefits, and job security. A lot of private employees, if you're hurt and away from work for the next 2 to 3 weeks, they might hire someone to take your place, and now all of a sudden you don't even know if you have a job to come back to. Where in our program, everybody's on the same page and knows what that transitional return to work plan is about and when you will be returning back to your regular duties. Personally, I hope you never have to use this program, because the last thing we want to do is have you injured at work. Okay, that's our number one goal, is that you don't get injured at work. But if you do, to the severity that we may need to implement the transitional work program, it's good for you to know that we have programs in place that benefit you through that entire process. Okay, we're going to talk a little bit about personal protective equipment. If you don't have the personal protective equipment you think you need to do your job, please, please, please don't be afraid to ask for it. We'll do anything we can to make sure that you do have it. If you do have it, use it. Please use it. It's there for a reason. It's not there to gather dust on a shelf somewhere. And the utilization of personal protective equipment really starts at the top. It starts with commissioners, department heads, and supervisors. And if they don't think utilizing personal protective equipment is important, how in the world can we expect employees to think utilizing personal protective equipment is important? Okay, so I dare you to do this. Don't do what everybody else does if they're not utilizing personal protective equipment. If it's there and people aren't utilizing it, don't follow that group and not use it just because somebody else doesn't. Be a leader in your departments and say, I don't care what it takes. I don't care what you think of me. I'm going to utilize personal protective equipment because I want to protect myself against a potential workplace injury or maybe a bloodborne pathogen exposure. Okay, so be a leader in that fact and don't worry about what anybody else is doing when it comes to wearing personal protective equipment, because maybe someday it could save you from an exposure or maybe an injury occurring. We work really closely with our counties in looking for proper personal protective equipment for them at the best possible prices as well. In our road departments, getting class 3 safety vests and jackets. We don't recommend anything less than that. I would never buy anything for a county employee that was less than the maximum class 3 reflective safety vest. And these things don't cost a ton of money. Okay, we can get these class 3 safety vests for under $15, between $10 and $15. And these are the best that you can get. And we work with our road departments, our sheriff's departments, our weed departments to get them the proper visible personal protective equipment. In other departments too, we work closely with different things. In today's world, of course, PPE with masks and gloves and goggles and gowns has really become more important than ever. And unfortunately, because of the pandemic, I think people are utilizing personal protective equipment much more than they ever have in the past, especially in our first responder areas, our social service areas as well. And we work really closely with the counties to try to get this. Some of this stuff is hard to get. We have a lot of contacts that we can utilize to try to get the necessary personal protection you need or to replenish stock. So there's several different examples of things we can get, from welding gloves in the bottom middle to goggles to work gloves to latex gloves, masks, our CPR kits, portable CPR kits that we have our first responders carry with them, to have something with them that clips to a belt, fits in a pocket in a glove compartment, and you've got something right there for you at the drop in of emergency to have a personal protective CPR kit. These cost probably $10 to $12, but could save you a lifetime worth of contracting a bloodborne pathogen disease. So we're available, willing to help in any way we can to assist you in getting the personal protective equipment you need to do your jobs very safely. So now let's move on to our drug-free workplace. Again, we'll talk a little bit about the Employee Assistance Program and substance abuse policies, a little review. This year, we're going to talk a little about alcohol and signs and symptoms. In the past, we've talked about opioids and marijuana and other prescription-related drugs and illegal drugs. So we'll focus a little bit on alcohol signs and symptoms that people can look for in the workplace. First, with our employee assistance programs, there's two different types that we identify: a formal or an informal EAP program. A formal is where your county has contracted services from EAP professionals, and it's a paid benefit to you as a county employee. So check with your human resource department or your county auditor to find out whether you have a formal or informal policy. An informal means it's not paid for by the county, but the county still contracted services from EAP professionals to provide those services to county employees. And sometimes your county insurance, Blue Cross Blue Shield, or whatever you may have, may cover some of those sessions should you need to go see them. And all use of EAP is confidential, and you need to know who to turn to or where to go for help, especially in these times. I think EAP program assistance is needed more than ever, and we're hoping people are utilizing it. It's a confidential. No county employer knows who goes to it. The only thing they might know that it's been utilized, but they don't know who's gone, how many times they've gone, or what it's for. And so your EAP program designee should be posted on your bulletin board in the courthouse, and it should be posted in every outlying area. And here's a list that you can see of all the designated employee assistance program designees that the counties have contracted services with. Okay, this is easy to see on your computer screen in a webinar. If you're listening to the recording, it might be a little harder to see. So make sure you contact, again, your HR person or your risk manager to see who that is, or check the bulletin board and see who your employee assistance program designee is. Okay, now we'll talk just a couple minutes about the importance of developing a drug testing and alcohol testing policy at work. Highly recommend, and I think all counties now are pretty much using the 10-panel drug testing because it just identifies a lot more illegal substances than the old 5-panel test. We work with counties all the time trying to develop an effective policy that includes pre-employment testing. Very critical, and this avoids hiring people who have drug and alcohol issues and not even allowing them to get into our workplace. And pre-employment testing works. I have so many examples of counties that get a hold of me and say, you know what, we had a pre-employment test and 2 of the people failed it. Okay, we just did a great service to all our other county employees by keeping those people out of our workplace. Post-accident testing, a very critical part. Especially for any moving vehicle violation, for sure, you should be testing for all of those, regardless of the severity of that accident. We get calls all the time, and people ask us, well, should we report this and have a drug and alcohol screening because someone was just backing out of the parking lot or backing out of the shop and just hit a post or a pole and very little damage to the vehicle, nobody got hurt. Should we do a drug and alcohol screening for that? And our answer is absolutely yes, because it doesn't always depend on the severity of that accident to make a determination of when we should test or not test. We should be 100% consistent, because what if that person is under the influence of drugs or alcohol and 5 minutes later they drive down the road and are in a head-on collision with a county resident? Not only do we have a big issue there, we also have a liability issue for the county, and that's why we want to avoid that, and we shouldn't worry about severity of that accident. We should be consistent and do it all the time. Reasonable suspicion is the minimum we can have in a drug testing policy and alcohol policy, but it's very difficult because people don't like to get involved. People are going to need to know what to do in a reasonable suspicion scenario of knowing what to look for, and we're going to talk about that today that might help you along that process in reasonable suspicion. And then testing can also be done randomly for employees who work in safety sensitive positions. We have some counties who have random testing for all employees in safety sensitive positions. There's not a defined definition of what a safety sensitive position is, but anybody using vehicles, anybody using equipment or heavy equipment or those type of things are definitely fall into those safety sensitive positions. So we'll talk a little bit about alcohol issues in the workplace. Alcohol is the second most common form of substance abuse in the United States after tobacco addiction. And alcohol abuse costs society $442 billion a year to employers and to society. So that's a high number with that. And do you think that we're seeing any increase with more employees working remotely from home now? I bet there is an increase in alcohol use in the workplace with people working remotely. We just don't have a way to put a number or feel on that until, of course, something might happen. And we do have drug and alcohol issues in county government. We're not immune to the problem that's in the workplace with drugs and alcohol. We do have situations that arise. I could give you a lot of examples of drug and alcohol issues we deal with a lot, but for confidentiality reasons for the counties of where they occur and stuff, we don't talk about them a whole lot, but it does go on, and we can't turn a blind eye to that, and we need to deal with that. And I saw a national statistic where it said 69 for every 1,000 government workers use alcohol at work. Okay, so if we have 7,000 approximate county employees working, and we have roughly 70 per those 1,000 that have a drug or alcohol issues, we potentially could have 490 people, with drug or alcohol issues in county government in our state. Okay, and that's a lot when you think about that. So how do you tell if a coworker is drinking on the job? You must identify some of the signs. Now, keep in mind that all of these signs or some of these signs don't mean somebody has an alcohol or drug-related issue. It could be because of other things going on in their lives as well. But you might notice a change in the mood or behavior, maybe a lot of unexpected absences. They call in and make up excuses that something happened to their car or there's family issues. Maybe there's a lot of Monday and Friday absences from work. Of course, the smell of alcohol. Maybe they're tardy or gone from work a lot more than normal. Alcohol and drug abusers in the workplace are 4 to 8 times higher chance of being absent from work. One thing you can really watch out for too is people spending breaks and their lunch breaks in their vehicles. If they're consistently going there for their breaks, that could be an indication that somebody's going there for drugs or alcohol. There's increased combativeness, agitation, they're more irritated, a lot more mistakes. Maybe they're not meeting the deadlines that are set for their jobs or getting the proper work done because of loss of productivity. And you just see them maybe taking more risks than normal. So how do you talk to a coworker or an employee about drinking? Maybe a coworker approaches another coworker because they're friends and they're worried and they're concerned about it. Maybe a supervisor approaches a coworker, and sometimes supervisors and employees are friends, of course, too. But we need to talk to them about it, and we have to adopt a caring approach to that. We talk to them about it. We talk about things we're seeing with facts and statistics, and things that you've observed, okay? And so we want to direct that type of thing to those people. Um, and you need to report that to your supervisor and human resource department immediately too if that happens. Make sure you come with specific examples. Don't wait 3 or 4 days to go and report something. The sooner you do it, the sooner it can be addressed. Okay. And we're doing this out of concern for our coworkers. Okay. There's no malicious intent with doing this. We're trying to help somebody, and we're also trying to protect them and ourselves. And then supervisors should also report that issue to HR if the employee hasn't. And it's important to get your HR involved because they advise management of the adverse disciplinary or other administrative actions that may be taken or can be taken, the laws associated with what can be done and what can't be done. And human resources also provides advice to employees of their rights and their procedures as well. So what should employers do if they suspect an employee is under the influence? First, understand the common signs, some of those that we just talked about, and document. You have to document situation scenarios and things that are occurring in the workplace. Sometimes you don't have time to document, right? Maybe it's something you have to address right then and there, and so you have to be prepared for that as well. And avoid making accusations. Be specific with your facts and findings when you do talk to them. Know the laws of what you can and can't do. That's where your HR comes into play as well. Know your drug-free work policy, okay? Follow that as well. If you're intervening with them, if it's something that you're not doing right then and there, intervene when people are sober and talk to people when they're sober. Know where your drug and alcohol testing can be done. I had some questions from some counties in the past. If there was a suspicion of somebody being under the influence of alcohol, could the sheriff's department administer a breathalyzer? And I did talk to our legal team here at the Association of Counties, and they informed me, yes, if you need to have a breathalyzer done on someone, the sheriff's department could certainly administer that. Now, depending upon the results of that breathalyzer, that would be a determination for you maybe to take further action. Maybe as a result of that breathalyzer, you do then take them in for a blood test to get a more accurate and the best accurate reading that you can get. And then always be prepared to follow through with your plan once you find out the results of that. So how do you document reasonable suspicion? You're going to receive complaints. Maybe you're noticing things yourself. Assess that situation. Observe the employee as you can, unless I said it's an immediate thing that needs to be addressed. Document those observations. At some point in time, you're going to meet with that employee. Always remove that employee from safety sensitive positions. And then if there becomes a determination where you need to have a drug or alcohol screening, make sure you prepare transportation for them. They should never drive themselves. And then send that employee for testing if necessary. Wait for the results and respond accordingly to those results, whether they're negative or positive. And that's where you refer to your drug-free workplace policy as to the actions that you take. And then work with HR to document and respond to an employee's refusal to take a test, okay? And then let them know the consequences of not taking a test if they refuse to do so. So what would you do about a coworker who you suspect to be under the influence of drugs or alcohol on the job? Would you ignore that? Would you report it? I think a lot of people have the tendency to ignore those type of situations. People don't want to get involved. They want to avoid conflict. They think it causes problems. They think somebody's not going to do anything about it anyway. So even though you think that way, we do need to get involved. Because are you enabling the behavior to continue? You are, if you cover for your coworkers' mistakes, cover for their poor productivity, or if you make excuses for them and you're just ignoring it, you're enabling that person to continue that pattern. And so we don't want to have them continue that pattern because all they're doing is avoiding the consequences of their habit. and know as well that people who abuse drugs or alcohol in the workplace um, are more likely to cause accidents occur in the workplace. Okay, so who's really at risk? You are. Okay, because you could possibly be injured due to someone who's abusing drugs or alcohol, carelessness, and disregard to safety. Okay, and that's why it's important to talk to management. Okay, you as employees sometimes know of a drug or alcohol much sooner than management does. So it's your responsibility to talk to management when performance or safety issues come into play and affect you and your job because of someone else's issues in the workplace. And ignoring those situations could lead to serious workplace accidents to you and your coworkers. And we've seen a lot of situations where the people getting injured are not the abusers, it's the coworkers because of the carelessness of the abuser. So you are at high risk to get injured. And good management will take the initiative and pick things up from there. Okay. Sometimes people are scared to go to management. We understand that. Or they've gone to management and nobody's done anything. If that's the case and you don't want to get involved, know that we here at the County Employer Group are willing and able to assist in any way we can, and we have. And it doesn't fail. After every year of conducting this training, someone will call me, email me, send me a letter, and let me know if something's going on in their county. And that's just another avenue and resource for you to address drug and alcohol issues in the workplace. So with that, that is the end of our training for today. Again, I want to thank you for taking time out of your busy schedule to attend, listening to some of the refresher training and some of the new information that we have. If you ever have any questions, please give us a call, email us. Our contact information is there. My phone number, email, Jennifer Mormon, our internal claims management, and Patrick Engelhardt, our safety specialist. We're all here and willing to help you with any issues that arise in your workplace and assist you with training issues, specific training issues, or whatever it takes for us to come to a point where we don't have workplace injuries and we want to prevent those as much as we can. So I didn't get any questions through the webinar. If you do have anything, please contact us and we'd be happy to help you. So thank you once again for attending. Have a great rest of your day. And remember, work smart, work safe.